everyone. This is Dr. Han. From now on, every Sunday morning at 11 Pacific Standard Time, we will have this interview with all over the world, the people who knows Dr. Tan, how did they know Dr. Tan, and why are so fascinating that they want to learn the balance method continuously. And I also make them to share a case study with us. So this is a great opportunity. Just tune in every Sunday. We will have live streaming and on the Facebook and the Zoom. And then in the future, and I will posting on all the speakers and all the interview people that we will be selecting and online. So you will know who will be the next one for the interview. And all these people that I pick and choose from are the most senior one to start with. And then we did it with Josh and Christian. And now I introduce you guys Shant. The reason why I pick him for this time, because I would also like to share this great experience for all the people who is newcomers, who are the new practitioner for the balance method. And you can be like him, even though he only practiced not as long as 10 years. He's into year number 6. So that's the reason I want him to share a little bit how he feel, how he bridging from the school to be able to practice, because the school is great. School gives us an opportunity to learn the basic, to learn the foundations, to learn the core, learn what is acupuncture or the meridians. Those are great. However, when you're coming out from school, sometimes you feel like, oh my God, I learned so much. What do I need to do now? So he's learning how to bridging from the school and finding a method that you can practice with the instant results. I like him to share that experience with all of us and you, and then you'll be able to understand we all go through that. And it's a great experience and great life that you choose to walk, a great path that you choose to walk on. So that's the reason why I have Sean this time to join us in this time. So let's see, is John, hi Sean. Sean is here.
Good morning.
How are you? Are you nervous a little bit, or you're doing okay?
I'm doing okay. A little bit nervous, of course, but I'll do my best.
All right. So let me introduce you, Shant Baboujian, okay? Shant, Dr. Shant Baboujian is a sorry, I'm a little nervous today. What happened? So Shant is a devoted and exclusive balance method acupuncturist for the past 6 years. Dr. Baboujian apprenticed with Dr. Eileen Yue Ling in her clinic Essential Health Acupuncture in San Diego, California. Oh, by the way, that's me. Passionate does not begin to describe Shant's enthusiasm for the Chinese medicine. In his early years of study the Chinese medicine, in the study, he pursued the neuroscience and the molecular. Sean, you might need to help me with what that is. Molecular.
Good job.
All right, molecular biology research, but was disappointed by its incapable to reveal Chinese medicine. Now, his favorite part of the day is seeing the shock and wow when the patient experienced the instant results of the balance method acupuncture. And Sean loved to keep busy participating in the humanitarian expeditions, assisting the balance method training seminars for the Academy of Acupuncture. He loved reading about Chinese medicine at his free time, and also staying active through multiple forms of fitness. Above all, Sean loved to infuse laughter whenever possible to connect with this essential quality that connects every living being. So let's welcome Shant Baboujian to join us for this interview.
Hello, everybody. It's good to be here. Thank you for gathering. Thank you for your time. And Shifu, thank you for making an interview with me. It's a big honor.
Great. So I like to know, and I'm sure everybody wants to know, how 6 years ago that you finished your school and you do all that, and how did you find Dr. Tan, the balance method?
So, fresh graduate, nothing to do. I'd found a job on Craigslist at a chiropractor's office and seeing maybe one patient a day. But I'm at the office from 9 to 6 and I don't have any office duties. I just have to sit there and wait for a patient to be referred to me. So I have a lot of time to do what? Browse the internet, watch Netflix. What I did was I looked around for what I could study. While I was in school, I'd get like the Ping Wei Lun or Shanghan Lun and go to my teachers and ask them, what is the meaning of this movement of the 5 cycles? And they would just look at me and say, Shant, right now, just focus on your kale. And after you graduate, then you could dig into these other texts. So I was like, oh, fine. And so now I've got all this empty time. I'm sitting in an office with nothing to do. Now is my time to study. And so online, I'm listening to this video, I'm reading that book, and along the line, eventually I saw a Dr. Tan video. And when you know, when you connect with something, the connection is there. And what he was talking about just made so much sense. It made the language of Chinese medicine make sense. I remember being in school and in the intern room, me and one of my colleagues were, if you're out there, hey, Michelle, her and I were talking like, this is so BS. Whenever the theory chooses, it uses that connection and that connection, but not on another time, only here. But then when I try to say it that way, no, that's not when you use it. So it was very confusing to know how to understand the language of Chinese medicine, almost like how to speak the grammar, how to arrange the theory, this and then this and then this. And so when I watched Dr. Tan's videos, it really streamlined what yin and yang meant. And it just kind of opened my eyes. The same way, like when you tell somebody a joke and then they get the joke and you're like, yeah, you get the joke, right? That feeling inside. So that's the feeling inside that I had when I was learning this, the balance method. I was like, okay, yes, I get it. And then later that day, I had a patient come in and I put the needle in, applying Dr. Tan's method, and the instant result. And the patient was like, wow, how'd that happen? You put the needle there and I felt it here. So it was the same feeling of telling a joke and the other person gets the joke. You put the needle in some distal area and then the body communicates and then feels that opening somewhere else. And the patient looks at you, well, how'd you do that? And then you're like, yes, your hope was answered. I hope that I'll put the needle here. They're actually going to feel that therapy over there. And then you put the needle in and you look up and then the zap happens, the reaction happens, and that feeling inside is just, that's what makes my day.
Awesome. I can feel your enthusiasm. Totally, that everybody can feel that you're so excited about practicing the balance method acupuncture. So I'm sure that is also fascinates you, that why you want to follow Dr. Tan's balance method around. So then let me ask you, how did you find me then to learn from me at San Diego? How did that happen?
So it was 2014 when I found the Dr. Tan's videos. But I was remember when I was still in my master's program, wanted to dig deeper into Chinese medicine, but they wouldn't give it to me. So as soon as I graduated, I'm like, okay, I better then go to the next highest degree, join a doctorate program. So then I joined the doctorate program, also empty. It's just very still superficial. I'm not getting that. And when I found the Dr. Tan seminars, I thought, oh, it'd be so great to learn from him. But my money is so tied up. I'm just like one patient a day, and I'm paying my tuition for my doctorate program. I'll just wait and then catch it, you know, once I finish my doctorate program. But you know, it was a hard lesson learned, as you may imagine, that I missed my chance to learn from him. And by the time I was done with my doctorate degree, the next in line was you. You are wearing now the crown of Dr. Tan, you know, carrying the torch to the next generation. And so, who else will I learn from? Not from any secondhand lineage. I want to go directly to the source. So I saw San Diego. It's just right here. I live in Los Angeles, 2-hour drive. Great. Booked a hotel, booked the seminar, came down, and it was love at first sight. Love with a heart. You even needled me heart 1 at that seminar. Do you remember?
Oh, yes, I remember. I used that photo to do I did a poster on that photo. So that was really phenomenal when you were that happy face and me like looking for heart 1. Yes, I remember. That's a really awesome seminar that you joined me. Thank you very much for coming down to San Diego for the seminars. Yeah. So that's how you find out that you have to learn the balance method in the proper way to go to a seminar, right?
Sure. And then go back home, and then now with that knowledge, have some experience, and then gain some wisdom with that. But it was still, some things were not really clicking. And then I, like a firefly, just rotating around the light. I came back to the next seminar. I did it again. And then things that I didn't pick up the first time, even though I was there, I remember hearing it the first time, it never actually clicked until I heard it again the second time and the third time. And so again and again, kept coming back. And as you say,
I hope I teaching clear enough for you to hear it, right?
It is clear, of course, but it was so much information coming in. There's only so much room in the brain to get thousands of years of Chinese medicine all at once. It is overwhelming, a lot of information, and it's not like necessarily a lot of information with a lot of things to write down. It's just everything is so deep and so many layers to it that you don't really catch like the third or fourth layer until you've maybe experienced the first or second in your practice.
That sounds really good, because I always recommended all of you taking more classes, taking repeat, because you're growing, your knowledge is growing, your experience growing by treating patients, and then you're inserting the needle, the feeling is growing because you're touching your hand, your hand touching your patients with the needles, and then you can feel exactly what are you needling, what are you fascinating, why that acupuncture works. So you are totally from your knowledge from school, plus your experience, then that become your wisdom of how to treat patients. That is the most key points of you repeating it, because you continue grow, and the knowledge will grow with you once you retain your experience when you're doing your acupuncture with the logical way, which is the acupuncture 1, 2, 3. I am really happy that you'll be able to experience that, and then you can share with your colleagues and from your school. And then remember, we gotta get a shout out for your school. Tell everybody where you graduate from. And that school is really awesome to have a Shant as a student there. So tell us which school that you went to.
The Academy of Acupuncture. Just kidding. I went to Dongguk University. in Los Angeles. And
How
I got
many
my
years
master's
you
there, my
tell
doctorate.
us? Yeah, tell us more about your school a little bit, location and all that.
It's on 6th and Chateau on in Koreatown in Los Angeles. I made a lot of friends there, and I've been back to do my doctorate program there, in and out, seeing the staff, saying, Shant, how are you doing? And how's your practice? And each time that I go in and see them again, it's a different story. Yeah, it is a nostalgic feeling to go back and say hello to the, to my source.
Wonderful. And I also noticed that you've been secretly preparing your case study. So now we only have 15 minutes left. I'm going to give that all the time for you to explain to people the case study that you picked, that most memorable case study. I think this is the most fun part. Everybody's looking forward to it. So let's hear your case study.
Okay.
Great.
So, thank you. A young lady comes in, says, oh, I've got a neck and shoulder pain. And she puts her hand onto the right side gallbladder channel. And she also mentions that she's on her period. So then I ask, is the shoulder pain worse during your period or the same throughout the whole month? And she says, no, it's the same. And so this helped me to determine the fork in the road between treating Dui and Shaoyang concept or going with the heart spleen Shaoyang concept. Because the period, the hormone, did not make this worse. So this is not contributed to hormones, but the location of it, it's a side of the body. This is the Shaoyang region. So then I pick to do Dui and Shaoyang. And I'm gonna share my screen now to show a little bit more visuals. So it's about this area, okay? Does this make sense, Shifu?
Yes, it looks good.
This is the area where the X's are, where she was pointing to.
Okay.
And so this is the sick meridian. Step 1. This is gallbladder, and so on the right side. And I know it's system 3. We want to choose liver on the opposite side, on the left side. Mm-hmm. So I put the needles into liver 3. I put the needle into Dr. Tan's liver on the left. Then on the right side, I put the needle on GB41 and Dr. Tan's gallbladder. I didn't yet complete the upper limbs because I wanted her hands to be free so she could palpate herself. And so I put the needles in, and then I say, how is it now? And then she says that this part with like the lighter X's, that part had diminished, but now the pain was more down here. So now what I did was, I remember Shifu, you teaching me about intention. So what I did was I put my hand onto the needle handle, mm-hmm. And my eyes are still open, but now I'm thinking, okay, intention, send the intention from liver 3, like beam it up the image through system 3 to that area where there's the pain and get the rest of it. And then as I'm putting my finger there, in that state of visualization, all of a sudden the patient says, ow! And then I gently let go. And then I look up to her and I signal, okay, move. And as she's moving around and she's feeling, she says, oh, wow, yeah, it's gone. Wow, that's great. And this was that feeling, that the thing that you love when you are able to make this communication from the needle to the affected area. And so in my mind, I'm thinking, okay, maybe that's what Shifu was talking about intention. I have the power. Oh, so magical. But it wasn't until maybe a few hours later that I suddenly remembered there was a story in your seminar about Dr. Tan treating headache with 4 gates, and there was still that lingering headache on the UV, but he still used 4 gates to treat it, right? And
Yes.
so I realized, no, I mean, intention maybe, but actually what it was, probably when I was holding that needle with my mind trying to play intention games, maybe my hand got a little bit more heavy and it sunk, and the needle tip sunk from liver 3 down towards kidney 1 territory. And based on the image and the system 2, kidney balances the Shaoyang meridian, and hand Shaoyang, foot Shaoyin is kidney, hand Shaoyang Sanjiao. Well, where was the rest of the pain? It had moved now from gallbladder down towards Sanjiao. And so based on the image, yeah, it was my needle tip reaching into the kidney territory that actually did that. So that was a funny experience, a funny memory, and one that kind of clicked together knowledge that I had learned but never actually had applied to gain that wisdom of now when I see patients again, I'm now playing with that depth of things that I have learned from you.
So you're stumbling upon that results, and then at least you think of it and give it a thought that, oh, it's liver 3 connecting to kidney 1. So you touch the kidney meridians to treat the opposite side for the Sanjiao for sister number 2. Very good. That is a very good case study to do right now. And you want to continue the arm?
Yeah, and then I continued the rest of the arm, and then I said, see you in 45 minutes, have a good nap. And I came in, she was asleep, and opened her up. She's like, wow, that was great, thank you, I feel so relaxed.
So did you use the Jueying Shaoyang 3-6, or you use the imaging and mirroring? Do you want to share that with everybody?
I used the 3-6 because I'd already knocked off the pain. There was no more pain for me to chase. So because this is an ongoing thing that happens throughout the whole month, and it's the side of the body like this. Yeah, this was the primary area, but she had her hands kind of placed and doing this whole thing. So I figured that there is some sort of a stress component, but we didn't need to get there because I already saw her doing this. Is that a good assessment, Shifu?
Yeah, it is very good, because I always keep on remembering Shifu, my Shifu, your Shigong, mentioned it that when you do internal medicine, which is the pattern, when you're doing the Bagua for the converting, that's the one that you're doing is the Meridian Conversion method. And he always says that, don't forget, when you do the Meridian Conversion, you are treating the whole meridians. So that really covers what's wrong with the whole meridian. So you are covering the gallbladder meridians on the shoulder and Sanjiao meridians, that even though you're touching the points that, so let's separate that. So one is the pattern for the Meridian Conversion. The other one is Acupuncture 1, 2, 3, which you use the kidneys and balance the Sanjiao. So which is a very, very smart idea that you do. Okay, you are all right to be able to do both the pattern plus 1, 2, 3 together. So once you're in a certain level or practicing with the balance method, sometimes you can mix the patterns plus the acupuncture 1, 2, 3. But one thing is very important. Make sure you don't disturb the meridian conversion meridians that you're using the pattern. Then that will be, otherwise you will be destroy the gua. So that's will be the number one thing to be careful. So people out there that you're practicing it, yes, when you do meridian conversion, just do the meridian conversion on the meridians that you choose. And however, the other meridians you can do acupuncture 1, 2, 3. Very good. Very good. So did you do Anian 5? Is the patient doing all right? Sleep good? And what else you want to give us about the case study?
I also added Anmian 5 because she was feeling a little bit of heaviness and tiredness and inability to sleep. Sleep that was being very long and not complete, so she was still tired. And again, I asked, is this only during your period or throughout the whole month? And it was throughout the whole month, that she's just sleeping a long time. And so, okay, maybe she's not really completing her sleep. Maybe there's something with breathing. I don't know that, but let me start with adding Anmian 5. That is the main go-to quick and dirty for helping somebody get good sleep. So
since you're bridging the school with your practice, I have one little recommendation for you. Since she's a girl and she also during her period time, right? And don't forget, any lady comes in, they usually will have some hormone balance issues, right? So on this particular time, or anytime when the female lady patient comes in, and when you use the pattern like this, maybe you can add spling 6 to help for hormones. And I love your case study, don't get me wrong, okay? There's sometimes you can do just extra needles to help, you know, because we're treating the disease before even it happened, right? So then you adding 1 spling 6 or something along the line with that, or gongsun spling 4, right? Is also very helpful. So those are something that you can think of. And because we learn from school, we don't want to trash everything from the school, because it's very supportive to what we're doing with the balance method. You can help, and you can add them to help. Still learning so much from you, Shofu, even though it's such a simple thing you say. Thank you. Yeah, don't give up what you do in school, because they're very valuable. And adding, you know, the concept, those are our foundation, our ground. And then you're learning the core from the Dr. Tan's balance method. You can even use it even better in the way that will help you to make it become a better and better, more complete treatment. Okay, I would like to share this information with everybody. Sean is apprenticing with me for this few years and practicing my clinic. And he also helping me for the Academy of Acupuncture, posting all the case study and helping for the writing of transcribing some of my books, and helping for editing all the books, and also helping for case study, for the videoing, for also all the clip for the videos that we are recording. And hopefully in the near future, we will have a home study program, so you can watch our TV videos for teaching online, and will become a home video and a home study video. So let's give a big applause for Sean, that he is helping everything from the in-person seminar. Hopefully we can go on through the virtual learning. And of course, eventually when this pandemic finish, I will also love to have you come in to work with me in my clinic, and also go with me with the medical missions. And here are the things that we are doing. Hopefully we keep connecting. And then anything you have questions, go on to the WhatsApp group or go on to the Facebook group asking questions. And Shant usually have a firsthand access to my time. So I will answer. And usually I will asking to answer and how we like, you know, the concept, the thinking of how to do it. And the few things that you have to learn from the guideline of asking question. Number one, don't forget, you have to remember acupuncture 1, 2, 3. And please be clear about the question that you want to ask, and then we will be able to help. Okay, have to have acupuncture step 1. Also, if it's structure problems, then we will have minimal amount of improvements. If that can help the patient improving for 20, 30, 40%, that is already a great deal. And we help them to manage their pain instead of heal them, or instead of like, I can treat it and heal them completely. So please be careful when you are telling your patient about this kind of things. One more, if patient coming as a stroke patient, if they're long time ago, 10 years of stroke, and their arm and leg may not function properly, we might be able to help, okay? Any increasing of the strength of the hand or standing much more steady, those are improvements. Please do not think that is not good enough. You're already doing a great job. 10 years of stroke, 5 years of stroke, most Western doctors already give up on them. And we are the one can help them for the connecting of their software program, right? So that's how I recommend it to all of you. Please take more classes and have Shant help you somehow, somewhere, sometimes, and with questions. And he's very, very detail oriented, much better than me. So I'm very happy to have him support me in the journey of the teaching and in the clinic. So you will see him often. Thank you very much for joining. Shant, you want to say something to everybody?
Yes. You along the way, along the seminars, with me attending, always coming, always showing up, always showing up. That's something that you always said, just show up, just show up. And so I did. I just kept showing up. And then you said, come to Costa Rica. I came to Costa Rica. That enhanced my experience tenfold. Having that hands-on, the treating 100 people a day right beside you, that was such a boost. And then just keep showing up, keep coming back to the seminars. And then you say, Shant, come with me to Asia, help me out to signing people in. And I was like, okay. And then like, come and intern with me. Okay. So each time showing up, and it built me. And so it reminds me of Li Ganjianyin, when you stand the pole and you see the shadow. So just show up, just put the needle in. It's going to work. Just show up. It's going to work. But also, when you do show up, you can't be an impotent needle, like kind of just like hanging. You show up and show up. Actually do something. Be there and like bring your heart into it. And there will be a shadow. There will be a result. So to everyone else who wants to join, Shifu still has so much to teach and a lot of space to teach. So just keep orbiting around her.
Yes. Thank you so much. Our time is up. So I will see you guys next Sunday, and you're gonna be a little secret that who we're going to introduce. So keep watching, keep the information, and make sure you visit our Facebook so you'll find out who will be our next very wonderful doctor that followed Dr. Tan for many years, and he also visited China with Dr. Tan, and we will introduce him to all of you, and we will see you soon. Thank you, everyone.
Thank you, Shifu. Thank you, everyone.
Thank you. Bye-bye. See you Sunday.